Before I go into detail talking about the management of type 2 diabetes, I'd like to explain about the regulation of blood glucose inside our body. So there is an organ called pancreas, and it is located just behind the stomach. What this organ do is to produce hormones, which are insulin and glucagon. These hormones have opposite effects on levels of blood glucose, which helps maintain our blood glucose levels within a normal range. During digestion, foods that contain carbohydrates are converted into glucose. Most of this glucose is sent into the bloodstream, causing a rise in blood glucose levels. High glucose levels stimulate the cells in pancreas called the beta cells to secrete insulin hormone. This hormone stimulates first body cells to take up more glucose and second, liver to take up glucose and store it as glycogen. These stimulations make glucose levels return to normal levels. On the other hand, when blood glucose levels drop below a certain point, for example, after skipping a meal, the other type of cells in pancreas, called the alpha cells, release glucagon hormone into the blood. This hormone stimulates the liver to break down the stored glycogen into glucose and then release it into the bloodstream. This causes blood glucose levels to rise. In diabetes mellitus type 2, contributing factors which are heredity combined with excess body weight, sedentary lifestyle, and certain ethnicities, these factors are somehow cause the body to have insulin resistance. The beta cells of the pancreas are actually still producing enough insulin to decrease the sugar level in bloodstream. But body cells stop responding to insulin, or they won't allow insulin to do its job, to take the glucose into the cells. This leaves all the glucose floating around in the bloodstream. The pancreas then senses there's a lot of glucose present in the blood, so it starts to release even more insulin, causing a condition where the insulin levels in body are abnormally high. Diabetes mellitus type 2 usually affects the adults after age 40, but now it also can begin during the young age due to the increase in number of childhood obesity and more young generation who practice unhealthy lifestyle. Diabetes is often regarded as a silent killer. The signs and symptoms of diabetes mellitus type 2 include the presence of glucose in urine, increased urination, increased thirst, increased appetite, blurry vision, slow healing sores, and frequent infections. A person can have type 2 diabetes for years without knowing it because the signs and symptoms I mentioned before tend to be mild or even absent initially. This disease then slowly damages the body, causing several complications like cardiovascular disease, visual impairment, kidney failure, and nerves damage. If there is no further action to overcome with this diabetes, what will happen next are decrease in productivity, disability, until premature death. Lifestyle modifications are the cornerstone of treatment for diabetes, and this can be also applied by everyone. With a healthy lifestyle, people without diabetes or individuals at risk of developing diabetes can prevent themselves from suffering diabetes, and for those people with diabetes mellitus type 2 to live a full and active life without any of the complications. The first thing you need to do to effectively manage type 2 diabetes is to adopt a healthy eating habit. Healthy diet is an important tool to keep our heart healthy and blood glucose levels within a safe and healthy range. It doesn't have to be complicated or unpleasant. The diet recommended for people with type 2 diabetes is the same just as the diet of general population. According to the food pyramid made by the Ireland's Department of Health December 2016, vegetables and fruits are the base of the pyramid, followed by carbohydrate sources, dairy products, protein sources, fats, spreads, and oils, and the last food group on the top of the food pyramid, namely foods and drinks high in fat, sugar, and salt. So what's that supposed to mean? The food pyramid gives us some key message for healthy eating. First, eat less carbohydrates and eat more vegetables and fruits. Because remember, in diabetes people, their body cannot effectively process carbohydrate, which is broken down into glucose into the body. And second, to limit high fat, sugar, and salt foods and drinks. Other things we need to do to maintain a healthy diet are to eat regularly, or make a schedule for meals and snacks. Choose healthy snacks. Drink water rather than other kinds of beverage. Be careful not to overeat or to eat in a smaller portion size, and also read the food labels closely. Number 2. Engage in physical activity. Exercise is also part of the things people with diabetes type 2 should do for maintaining a healthy weight and for regulating blood glucose levels. Regular exercise have been proven to increase the insulin sensitivity of our cells. Aerobic exercise is the most common type of exercise done by the diabetic people. This type of exercise includes walking, swimming, and biking and running. Resistance exercise including weightlifting, yoga, and calisthenics can also be done to increase strength, balance, and ability to perform activities of daily living more easily. Get about half an hour of exercise daily to help keep our heart healthy and to control blood glucose. Talk to your doctor first before you want to start or change your exercise program to ensure that activities are safe for you. Another thing we need to do is limiting inactivity. When we sit in front of a computer for a long time, for example, remember to take a few minutes to stand, walk around, or do some light activity every 30 minutes. Number 3. Lose weight if you're overweight or obese. Remember that being overweight or obese is one of the contributing factors for developing diabetes mellitus type 2. In overweight or obese people, there is an excessive weight in their midsection and around abdominal organs like the liver. This is known as visceral fat. This visceral fat promotes inflammation and insulin resistance. Adopting a healthy eating habit combined with doing regular physical activities, it can control our weight within the normal range. Number 4. Avoid smoking and drinking. Several studies have shown that smoking and drinking habits can lead people to have type 2 diabetes or worsen the diabetes in people who already have it. The high levels of nicotine in a cigarette can lessen the effectiveness of insulin, causing smokers to need more insulin to regulate blood sugar levels. Nicotine can also increase the risk for developing cardiovascular, kidney, and eye disease and also nerve damage. While drinking alcohol can cause inflammation to the pancreas, and if it happens, pancreas cannot produce either exocrine enzymes like amylase, protease, and lipase, and the endocrine hormones which are the insulin and glucagon. It is better for us and for people with diabetes to avoid or stop cigarette smoking and consume drinks containing alcohol. Number 5. Monitor blood sugar. Monitoring blood glucose is usually done by a device called glucometer. This device measures the amount of sugar in a drop of blood. Remember to keep records of the measurements to share with your doctor or other healthcare team members. It is recommended for people with diabetes to check their blood glucose level regularly to make sure if their blood glucose remains within their personal target range. Number 6. Use medication appropriately. If lifestyle modifications are not enough to keep diabetes mellitus type 2 under control, the usage of certain medication may help. For example, metformin, the most common medication used by people with diabetes mellitus type 2, which can lower blood glucose levels and improve how body responds to insulin. Remember that the use of medication can cause side effects. There are also certain medications prescribed by the doctor in addition with the diabetes medication, such as low-dose aspirin, which help prevent cardiovascular disease, or blood pressure and cholesterol-lowering medications. Not everyone with type 2 diabetes needs to use insulin. Insulin therapy is needed for those whose body cannot make enough insulin. Your insulin type, dosage, and schedule will be determined by your doctor depending on how stable your blood glucose level is. Hypoglycemia or low blood glucose level is the side effect that can result from insulin therapy. It can be prevented by taking the medication and insulin with a meal. So that is the management of diabetes mellitus type 2. Thank you so much for watching.